My name's Michelle Webb. I'm the Director of Care for St Barnabas Hospice. One of the responsibilities I hold in this post is to develop a quality account for the organisation. The quality account that we produce sets out patient improvements for the year for the hospice. Some of you might be wondering why we have to develop a quality account. One of the main reasons why we produce this document is because we are fortunate to deliver 2 or 3 NHS contracts, and the hospice is large. We're over 50 employees and we have a big turnover, so that dictates that we have to produce this account. This year we are really lucky to have developed 5 priorities. The clinical teams have decided the priorities at some of our clinical meetings, and some of you may be working on those as I speak. Within the document, there's quite a lot about our services and our clinical strategy, and there's an awful lot of data. So the data focuses really on those things that impact on patient safety, numbers of contacts that we have, if we've had any complaints or any incidents, and how we've investigated those to a satisfactory conclusion. Once the account is written, you might wonder what happens to it. Well, actually the account is validated by our commissioning team up at West Lincolnshire CCG, and we also have the account approved by Health Watch and by the Health Scrutiny Committee, which are both health watchdogs that we work really closely with in Lincolnshire. The priorities for 2019-20 are the Freedom to Speak Up Guardian post, and I'm sure many of you will have seen the posters and Rose Gray out and about, and also doing her talks at mandatory training. There's also priority for the Admiral Nursing Service, and that is developing nicely. We now have nurses recruited to every quadrant. Our nurse consultant Kerry Burham has been working really hard to support the quality account with her a priority around improving pain management for patients, and there's been a whole education agenda for staff through Project Echo. Our allied health professional team have also been really busy supporting improvements in palliative rehabilitation and exercise. And our final priority this year has been the use of the triage tool in MDT, which is proving absolutely brilliant at making sure our patients get everything that they need. We actively report on the quality account throughout the year, so myself and the people who've got priorities pull together a report each quarter, and to make sure that we are delivering the improvements that we pledge to make for our patients and families. So in April, July, October and January of each year, we produce a quarter report which is shared with our trust board to make sure that we are progressing with the priorities that we've defined. If you are interested in supporting a priority during the latter part of this year, so the governance team and myself normally start considering the priorities in January for improvements, please come and talk to me. I have plenty of copies of the quality account, and I pledge to make sure there is a copy in each base for you to take a look at. It's full of really interesting information, and I'm sure some of you will have seen it in different places, but it's good to have it in one document. And just as a reminder, the quality account is also available on our website. Thank you.